intervention is one of the most basic tenets to the world of social work practice. A social worker's goal is to help their clients process and overcome problems, meet their established goals, and help improve their quality of life. One form of therapy designed to do this is called client-centered therapy. It is a strengths-based model that was developed by Carl Rogers. Client-centered therapy was the foundation for both solution-focused therapy and motivational interviewing. And a unique characteristic of this approach is that it does not follow a specific action-based model. This intervention, although not as prescriptive as most other interventions, aligns with many modern ideas based on empowerment. Rogers' theory and development of client-centered therapy focuses on the client's strengths versus taking a psychopathological approach. Therefore, this therapy is unique in the fact that the client will drive the therapeutic process. The environment that is created by the practitioner is critical, however, and the success of this therapeutic approach is dependent on the practitioner's ability to create a comfortable and trusting environment in order to execute this process.
There are three main principles of client-centered therapy. Langer and Leitz qualifies them into three distinct buckets. The first being that there's a belief that personal and social problems occur when people are devalued. The second, that change happens only within the context of an authentic helping relationship, such as that of a client and their practitioner, their therapist, or their counselor. And that people are capable of self-actualization when the conditions allow for positive growth and change. Carl Rogers described these principles as practitioner behaviors, things that the practitioner must do in order for client-centered therapy to be effective. They are accurate empathy for the client, congruence and transparency with the client, and unconditional positive regard for the client. Additionally, Rogers viewed that there were 6 conditions that were required for positive outcomes when working in a client-centered environment. A lot of these conditions really focus around the relationship between the practitioner and the client. So being able to demonstrate that unconditional positive regard, having an empathetic understanding and looking to communicate that understanding with the client, as well as being genuine, and for the practitioner to truly be aware of their own feelings and at times be transparent and even self-disclose around those feelings. The other conditions were really about the client state. So the client being emotionally upset and in a state of incongruence, and then being able to recognize that the practitioner has that unconditional positive regard and truly understands what it is that they are struggling with.
Client-centered therapy has many strengths, including the fact that the approach is a versatile and flexible intervention. This flexibility gives freedom to both the practitioner and the client. The practitioner does not need to adhere to one particular protocol. There is no specific intervention, making therapy liberal and giving clients control over their treatments. The method focuses on developing strong relationships within the client's life in order for the client to gain supports. Once strong relationships begin to form, the practitioner encourages the client to utilize these relationships throughout treatment. Given CCT's flexibility, a therapist may decide to shift to using it as a way to have a more open approach to therapy. This strength gives the practitioner room to be creative in their approach to treatment. Lastly, CCT is consistent with the values and the tenets of the NASW Code of Ethics. When looking at the limitations, the approach can be seen as inappropriate for clients with severe psychiatric disorders, such as schizophrenia, or other disorders where the client suffers from delusions. The approach might be too simplistic and unstructured for some practitioners or patients. Practitioners should be comfortable with an approach that does not have specific intervention or direction. Clients may not feel challenged enough or may have other struggles with the approach. Practitioners may find that developing an appropriate client relationship is a challenge, given that the approach is already seen as quite flexible from the client's perspective. Boundaries might become easily distorted, so being able to remain self-aware and mindful is important for practitioners. Lastly, the nature of today's managed care focuses on efficacy of care. CCT requires an investment of time in building the relationship, which often conflicts with what insurance companies support.
Client-centered therapy is used with clients that have disorders such as depression, anxiety, and personality disorders. The therapy is also a good fit for individuals facing relationship issues, trauma, and other life disruptions. Research reflects positive outcomes for individuals that have had CCT. Due to CCT's flexibility, implementation of the therapy can be held just about anywhere. Practitioners could hold individual as well as group sessions, and it can be modeled for use in agencies, institutions, and outreach settings. This is part of CCT's flexibility, which allows for various populations to benefit from it. Generally, children are not considered a good fit for CCT. However, some of CCT's elements could be adapted and integrated while working with younger populations. Similarly, individuals who struggle with severe mental illness are usually not considered an appropriate fit for the approach. This is due to the client's limited perceptions of reality and possible self-harming behaviors. CCT would not provide enough guidance or structure through its approach. When thinking about working with diverse populations, client-centered therapy has some limitations. Individuals seeking faith-based counseling may not connect well with CCT and may feel that the approach conflicts with their faith. Although there is some evidence that shows a spiritual integration can be effective in the use of CCT, there is still a need to be careful in considering the approach. Multiple studies from various countries have shown that CCT has positive outcomes for a range of cultures and backgrounds. The approach can be adapted to suit client identities such as their race, gender, sexual orientation, and other personal factors. This adaptability stems from the Rogerian roots of empathetic understanding.